Hello, good afternoon to all those who are tuning in to the Community Research Academy today. We are so delighted that you're able to be with us this snowy afternoon. Hope all is going well for you. Today we have an exciting program, great information. We have two speakers. One is going to be Miss Jacqueline Vera, and she's going to talk about qualitative approach to research. And then we have Miss Tamara Crowder, and she's going to talk about the quantitative approach to research. Now, both of these speakers, they have a very extensive history in research. They love what they're doing, and it translates. You're going to be empowered just from hearing all that they have to share. First, we have Miss Jacqueline Vera. She has a master's in public health. She manages the day-to-day operation for the patient-reported outcomes, community engagement, and language core facility at Memorial Sloan Kettering Cancer Center. As a native Afro-Latino New Yorker who grew up in Hell's Kitchen, she obtained her undergraduate degree at Hunter College with a major in sociology. She attended the CUNY Graduate School of Public Health and Health Policy with a concentration in community health education and specialization in maternal, child, reproductive, and sexual health. She is fluent in Spanish and engages Latinx communities via relevant public health projects where she has conducted qualitative analysis. Ms. Vera is committed to working on projects that seek to engage diverse populations for improvement of healthcare programs and services. She is dedicated to serving her community and is passionate about her work. She enjoys traveling, hiking, and looks forward to running the New York City Marathon in November 2021. Ms. Vera, I look forward to watching you run the marathon in 2021. The next voice you hear will be Miss Jacqueline Vera. Thank you.
Thanks, Lula May, for that introduction. And we'll see. I don't know if they don't cancel it again. But yeah, so thank you so much, everyone. It's a pleasure to be here. My name is Jacqueline Vera. Agnes, am I able to share my screen?
Yes, you should be able to.
Okay, great. Let's see. All right, can everyone see that?
Yes.
Yes.
Awesome. Okay. Just bear with me. All right, great. So hello and good afternoon, everyone. It's a pleasure to be here. My name is Jacqueline Vera, and I will be presenting on qualitative research and clinical trials. So before we begin, I just want to take a moment for introductions. As Lula May mentioned, I work at Memorial Sloan Kettering Cancer Center, and I just want to give a little background about the ProCell Core that was mentioned. It's a mouthful. It's patient-reported outcomes, community engagement, and language core facility. And what we do, they're basically a team of experts who provide support to investigators across the institution who seek to use the various research methods, including qualitative research. And we also help identify scales, measures, and analysis of data while also engaging diverse populations within the community. So if in the research study, for example, the target population is non-English speaking, our experts, we would make sure and ensure that, all the study documents are translated appropriately. And if there's any focus groups or in-depth interviews that they need to conduct, we have those experts involved as well. But I also want to take a chance and get to go around and maybe have everyone introduce themselves by name. And then also if you could share whether or not you've participated in a focus group or an interview about your thoughts and feelings regarding a specific treatment, a program, or a service in a healthcare setting. And yeah, I can't see the folks, Agnes, so I don't know if, can you start off with whoever you know is on here?
Yes, so I'll start with Reverend Dr. Bruce Rivera.
Good afternoon, Reverend Bruce Rivera, pastor, Christ Church, UCC in the Bronx, and also the chair of Bronx Community Board 3. Thank you for being here, and we're excited about your presentation.
Okay. How about Uska?
Hi, I'm an undergraduate at Hunter College, and I haven't been in any situation where a focus group has asked me about my feelings on a situation, because I haven't been in any situation like that until, yeah.
Okay.
Hi, Miss Vera. My name is Miss Scanlon. I've never had the privilege or the pleasure in participating either in a focus group and or a study group with respect to the subject matter that is your focus. However, my late brother, Edward, did spend the last days on Earth at Memorial Sloan Kettering, and it was a very poetic and painful moment. The poetry was across the street, as you may know, are many of the Rockefeller endowed properties as well as research institutions. In the foreground of that space were gardens, were community gardens for children. And in the 1950s, my late brother, Edward, had the privilege and pleasure of then receiving from the then mayor of the city of New York, Mr. Wagner, a ribbon as the best gardener in the Rockefeller Gardens of all the children in the city of New York who had the pleasure of being there. So as far as I'm concerned, sister, you're in a sacred space. Thank you.
Thank you for sharing that.
Thank you. Anybody could just chime in, but how about Miss Wilson?
Hi, my name is Joyce Wilson. I forgot what the questions. No, I have not participated in any trials or been invited to any focus groups.
Okay.
Yeah, so sorry.
No, that's okay. I'm just trying to get a sense of who's had that experience or not. Thank you.
Yeah, welcome.
Hi, my name is Donna White, and I have not participated in the focus group. Hi.
Hi, my name is Jewel. I am a Deputy Title IX Coordinator with CUNY. I've participated in focus groups, maybe not what you're thinking about, but you know, Schlesinger has like focus groups and they pay people. So I did one had to do it actually with colon health, and they were actually, the product was like Cologuard. So I actually participated in that. And I do that, like for years I've been doing like different focus groups because there's money involved.
That's great, yeah. Okay, did we get everyone?
No,
Yeah.
I can go. So
Kenny,
my
yes.
name is Kenny Escobar, recent Master Public Health grad. I work in prevention now. In regards to focus groups, I've been exposed to how to create them. I'm actually creating a focus group setting right now at my position. But in terms of the specifics that you said, not really. I haven't participated in one yet.
Okay.
Like implementing them.
Hi, Jacqueline and everybody. I'm so glad that you're given this talk today. This is Jennifer Tiffany. I'm the Executive Director of Cornell University Cooperative Extension New York City programs. I have participated in focus groups and other studies and food tests, but not clinical ones. And I'm so excited to hear you're running in the marathon.
Thanks. Nice to hear you, Jennifer. I think, do we have everyone or any other folks who'd like to introduce themselves?
Yes, I'm Diane Mack. I'm with affiliated with Metropolitan AME Church and Creative Social Solutions. I am currently in 3 clinical trials, and I have participated in focus groups as well as held one.
Okay, great. Thank you for sharing.
I'm checking the list. I think we covered everybody.
Awesome. All right. So, okay, great. So what is qualitative research? Qualitative research methods are used to understand people's beliefs, experiences, attitudes, behavior, and interactions. It generates non-numerical data. So this means that the patient and or study participant's voice becomes data, right? Like what we say, our stories, our narrative. It's non-numerical data. So it means that the participant voice and their words is the data, right? So in other words, we're talking about open-ended data. It's a conversation, it's a story, it's the back and forth, which goes beyond surveys. These are experiences that we're trying to understand, participant experience that goes beyond the survey, which is kind of like, you know, what we mostly hear about and come across. Checking off the boxes, scale from 1 to 10, right? But this is different. We're talking and we're collecting your story, your narrative. So why is qualitative research important? If you take a quick look at this, this little cartoon here, this image, you'll see the difference between quantitative research methods and qualitative research methods. So here, the researcher using quantitative research methods is interested in how many people took the free ice cream. The researcher using qualitative research methods wants to know what people feel and why, right? This method provides context to the observed phenomena, right? So like the fact or the situation taking place and being observed, it's grounded in the participants' own words and their experience. So for example, how is it linked to the context in the participants or the patient's community, right? Or how is it embedded and it flows over time, right? Let's say it's free ice cream in, I don't know, the Bronx. Like I'm gonna flock and get that free ice cream versus, I don't know, if I live on the Upper East Side, I'm gonna pass and just be like, no, it's okay. I'll go buy like that expensive Haagen-Dazs. So this is understanding why. So let's think about why is qualitative research useful in the medical field? And I'd like to have an open discussion too and give you guys an opportunity. If you want to jump in and chime in, I'm just gonna ask questions. What would someone like to share like their thoughts or ideas of why they might think, you know, qualitative research is useful in a medical setting? If anyone wants to take a guess.
I think it advises the researchers about the net outcomes of one, and they can then infer to the larger. Without that qualitative experience, that core feedback, really the researchers, to a certain extent, are functioning in the dark because they don't know what the real impact, the real drill down, nitty gritty is in terms of the experience of the recipient, and therefore how that ultimately dispositively impacts outcomes amongst perhaps many, many other future or current participants.
Mm-hmm. Yep. That's a good point. Yes.
Diane Mack has her hand raised.
Oh, yes, please, Diane.
Yes, I think another way that it can be useful is to help inform a quantitative study, maybe to think about the questions you want to ask, because if we acknowledge that studies, the investigators are not subjective, they may be thinking about asking the question or have beliefs about why people are behaving or becoming ill. And when you hear people's stories or lived experiences, that may shape the survey or other larger study differently.
Absolutely. Yeah. So historically, you know, the medical field develops new drugs. That's what we know about the medical field, or interventions, and they capture this data, right? They want to understand the side effects and the outcomes. And then they analyze these results. And this is a whole process, but most of this research in the past, like without understanding the social context and not including the voice of participants, very little is known about how they feel and what they think about during the whole process. So why should we care? Why do we care about that? And you know, it really helps, you know, without understanding the patient attitudes, beliefs, like, you know, researchers are at risk really at developing an intervention that is not useful to the patient, or a drug or a treatment, right? It can have the risk of like it being used differently than intended, right? The purpose of the reason why they're developing this, it's not really used appropriately because they're missing all of this other very important rich data and information that is only captured through qualitative methods. And sometimes it could even be harmful to the patient. But luckily, you know, after many years of qualitative really kind of being known to the field, and in medicine, has become more interested in patient voice and patient experience. And we currently do have a lot of public health professionals that want that patient perspective, right? That's part of public health as well, is, you know, engaging patients' diversity and hearing and understanding their stories, and providing that context in research.
Jewel Jones has her hand up.
Oh, yes, go ahead, Jules.
I just wanted to add, you know, when the last part of what you were speaking about, I mean, the patient feels valued, that you know, they feel like the value, they feel like they're human, they're part of the process. If you know, acknowledge what the patient is feeling, or you seek that information from the patient. Going back to Henrietta Lacks, you know, and her family, no one ever had that opportunity to provide input or see the patient as a human being, provide my own thoughts and opinions about the research. So, you know, you should want that patient experience and knowledge from the patient.
Absolutely. Yes. Yes. Very good point, Jewel. And thank you for bringing that up. You know, it shows the respect, right, that we're owed as just human subjects is part of the study. And what comes with that is, you know, the integrity too, and ethics and all of that. It's really valuing who we are as people and what we can bring to inform science research, because it's a service to everyone else. It's not just about the individual. It's how can I also provide a sense of my experience to help others. So thank you for that. So yeah, now jumping into clinical trials, right? Clinical trials, they're types of research studies, and qualitative research can support all of these that I've listed here. It's a much longer list. This is not it. But for today, I'm just gonna focus on the first three that you see highlighted in red. But I'll give you a bit of like background of what they are. So intervention treatment generally involves an intervention such as medication, psychotherapy, new devices, or new approaches to surgery or radiation therapy. Screening research aims to find the best ways to detect certain disorders or health conditions. Implementation research involves program planning using the best practices informed by research findings and other evidence based practice for program evaluation and solution. And then we have these other three: prevention, research, quality of life, genetic studies, right? So prevention is looks for better ways to prevent disorders from developing or returning. Quality of life explores ways to improve comfort and the quality of life for individuals with a chronic illness. And then genetics is, you know, it aims to improve prediction of disorders by identifying and understanding how genes and illnesses may be related. So how does qualitative research support these types of clinical trials, right? It provides and it adds context, as I was saying before, right? it adds meaning and it adds insight for a particular circumstance, an event, a thought, idea, statement, the behavior, which was mentioned by some of you. And, you know, and it goes on, it's the experience. It helps generate in-depth insight into how a patient feels and what they think. So using qualitative research will uncover things like, you know, day-to-day activities that like you can't really design anything in a lab as part of a laboratory experiment to understand our behavior in natural settings, right? Like if we think about our day-to-day life, something that like we do at home, in our communities, the commute, our neighborhoods, our culture, our language, right? This is not something that can be captured in a laboratory. So we use qualitative research to do this. And also think about, you know, it's something, what is the something, the treatment, the intervention, the medication, is it being used how it's intended? And qualitative just brings more insight to that. If the program is already implemented or the service, are we actually being successful at collecting what we need? Qualitative brings more insight to that from the patient perspective. So what are the ways in which qualitative research methods are used in clinical trials? Going back to the types that I mentioned, that I discussed, our first example is treatment research, which generally involves an intervention such as medication, psychotherapy, new devices, etc. So in this example, qualitative research can help develop questionnaires that are understandable to patients. So again, getting at why. A researcher will conduct cognitive interviews, right? So this aims at investigating comprehension, retrieval, judgment, and response of the questionnaire after they've read it. So the researcher will ask the study participant after they've read and answered the questionnaire, what did you understand from answering this question? That's an example. What does this term mean to you? So looking at depression, this scale that I have here, and I'm going to use, and I love to include diversity also, which is part of what, you know, my passion is. I think about these questionnaires, and these are mostly done in English, right? We're here, we're in the States, everything is that's our main language. But there's so many diverse, you know, communities, cultures, other languages. I mean, especially here in New York, it's like we are like the center of all cultures, right? And so I think about my own family, and when I think about, well, if they were to look at a depression scale, a questionnaire, you know, I have relatives that are Peruvian and Colombian, and the word that they tend to use mostly is aburrida, which means bored, or triste, which means sad. It's not common that they use the word depression. So if they were to be given this questionnaire translated in Spanish, does that add value? Is that going to be helpful to gather the data that they need? The researcher might think again and think perhaps a different word that's more used in this community for this population. Let's rethink and translate it to that and use that word instead, right? So, you know, if we think about the target population and non-English speaking participants as well, would the word depression be useful? In some other cultures, depression, they don't probably even have a word for that. They probably use something else. And this can be in other, you know, kinds of, you know, research questions too, where they're looking at the subject matter. Does that exist in this culture, for this community, for this population? Let's make sure that we do that research. Cognitive interviews help us get this, right? The researcher, you know, they'll continue with more questions like, in your own words, what does depression mean to you? Or how easy or difficult was it to remember the last time you felt depressed? How did you feel about being asked this question? how comfortable would you feel answering this question over a phone, right? Over a phone survey, and why? How difficult was it to select, this answer versus the other choices you had? Why? Why did you select that option in comparison to others? Like, it's constantly why? But this is good. This helps investigators and researchers really, create a tool that is useful, that is valuable, and will get to, will really be able to capture rich data that's meaningful.
I'm sorry, I have a question before you.
Yes, I'm sorry, I forgot to say at this point.
No,
Any
I'm sorry.
questions?
This is Jerisha Wilson. So going back to these surveys, are they asking these questions by paper, or are they asking them verbally, or are they asking them by tablet? How are they asking the
Good question.
questions?
It depends. I recently participated or helped part of a research kind of do cognitive interview over the phone. The participant was in Miami. He spoke Spanish, and it was about 10 participants I had to interview for them to better understand the questionnaire that we were doing the study for, to translate into Spanish. And I mailed him a copy of the physical form, right, of the questionnaire. He filled it out, he read it, and then we made an appointment for me to conduct the interview over the phone. So as he's looking at the paper questionnaire, I am asking him, what did you think about this question, number one, and then number two, and all of that was recorded. It's de-identified. This is we don't use participant name. We assign numbers just as they would for any other study. And yeah, that's the recording then is transcribed, right? I look at the transcription and I pull the information from there, and that's how we analyze. But there's different ways we can do this. It could be in person, it could be over the phone. It could probably also be captured through a smartphone, but I don't know that any current studies have done that. But the most common way is definitely in person and over the phone, if that answers your question.
Oh, it does. Because I mean, I know I have seen like tablets, depending on the amount of questions, people can get a little bit frustrated.
Yeah.
Because it takes too long, scrolling through. They don't know what they're doing, whatever.
Yeah.
Okay.
The easier way is definitely paper form, and if it's ideal to have that in person, but sometimes these studies can be in they can be multi-site studies. They can have participant recruitment in other states, even in other countries, and that would be most appropriate to have a phone interview.
Right. Okay.
With the paper in front of them. Yeah.
Okay. Thank you.
Sure. So, okay, so our second example is screening research. Screening research aims to find the best ways to detect certain disorders or health conditions, right? So in this example, qualitative research can help recruitment and enrollment of study participants for, let's say, a smoking cessation program or a lung cancer screening program. So here the researcher and their team will conduct focus groups to ensure accurate representation of the sample, depending on demographics and efficient recruitment methods, and determine the best possible recruitment method to reach the target population, right? So let's say our target population are like Black and Latinx, communities and population, and we want to focus on recruitment in neighborhoods like the South Bronx and Central Harlem or Spanish Harlem. The researcher will have created campaign ads, and it could involve flyers, brochures, a video, a poster. They'll conduct these focus groups, and they'll ask the participants what they think. Was the information relevant to them? Did they understand it? Did it resonate? Do they see themselves in the ad, right? Was it too much information? Was it too little? Was there too much medical jargon? Is there perhaps a catchphrase that's known in your community? I don't know, I think about my mom, and she loves novelas, the Spanish soap operas. And if, she were to see something in a novela kind of format, that would be intriguing to her, and that would get her to probably get motivated and go get the screening for a breast, cancer or lung cancer in this matter. And we think about, how we bring this message to communities, right, that are diverse, that may not know English, right? How do we translate these messages appropriately as well? Are they culturally sensitive? This is how we understand more about the target population. We have focus groups, and we ask them these questions. We ask this question to get more information about whether or not our recruitment strategies, the researchers' idea, if it's going to be successful or not, right? We become the experts, the community members become the experts with their voice about what resonates, what's important, what would motivate them to go get a lung cancer screening test. Do we have any questions on this one so far? Okay, so our third and last example is implementation research, which involves program planning using best practices informed by research findings and other evidence-based practice for program evaluation and solutions. So here the researcher and their team will want to know how they can design this program, what are the potential barriers they may come across, and program evaluation includes what did the participants like or not like about the intervention? Why did they react to it the way that they did? It may also include observations of the community. This involves mapping and identifying locations that are appropriate. And it helps to overcome potential barriers, implementation, and promote uptake of the intervention. So it also helps generate in-depth insight into trial recruitment, helps to understand the feasibility and acceptability of interventions being tested. It also helps improve trial conduct. It can change procedures, such as methods of participant recruitment. It also looks at the background and the setting to ensure the relevance, identifying social, cultural, health, economic, or political factors that the environment might bring, which may affect the study. It might affect uptake. In this example here, this is a project that I had. It was my capstone project in grad school, and I looked at the social environmental factors and how they predict HPV vaccine uptake in an ongoing multi-site study. So here I used qualitative research to identify the barriers to study participation among Mexican immigrants in this study, which took place in multiple states. It took place at the Mexican consulates in El Paso, Texas, Las Vegas, Chicago, and here in New York City. So I actually traveled to El Paso, Texas. This is the border. And I also went and visited the Mexican consulate here in New York City. And I conducted in-depth interviews in Spanish, and I made field observations to understand the socio-environmental factors and their impact on recruitment of participants to this study, right? So here, when I visited El Paso during the summer of 2019, this was at the peak of, the Trump administration's intensified anti-immigration rhetoric. We don't want immigrants. We don't want, Mexican or any South American crossing that border, right? So while conducting in-depth interviews with consulate staff at the Mexican border, I identified and documented multiple barriers to accessing healthcare. what did this look like, right? The research that I gathered provided preliminary data that indicated, you know, that Mexican immigrant population, that fear has the potential to negatively impact participation in public health programs. In one of my interviews at the consulate, you know, a community healthcare worker, she said to me, the barrier is fear of deportation, right? This was a quote from my interview with her. And it prevents families from seeking medical help. So if you look at the pictures here, I told you about the border. And then here on the table, there's this brochure, and it says, in Spanish, it says, si te detienen, which means if you get detained, what do you do? If you get detained by ICE, they had little cards, make sure you carry these kinds of documents in your pocket. Like all of these kind of alert, right? Information that really instills fear of people who are walking through those doors, and are they willing to participate in a study? You know, there's fear that sharing information about themselves will get them deported. So that's a barrier. That's an environmental, socio, like all these things that I just mentioned. You know, it competes with the attention of this population for participating in a health study or a program. You know, there's other concerns that I found out, such as financial and housing insecurity. And all of these things, you know, it illuminated the need for recruitment initiatives to consider culturally appropriate, tailored research methods, right? That also consider the socio-political atmosphere and understanding these barriers. What about, you know, maybe the consulate at that moment could have been an addition to other locations. What about a neighborhood street fair? There's music and, you know, food, like people love that. They'll be more comfortable. They'll be more open to share personal information and you know, become a participant or want to become a participant in a study. So all of these things, right, through observation, through in-depth interviews, we can understand better the context of like the hesitancy or how a program may not be doing so well. Hey, why are we not seeing more participants engaging or wanting to, you know, participate in our study? Well, these are the reasons why. We need to be more creative about engaging community members and doing outreach in ways that help facilitate safety, right? Because this is the information that we gathered. These were the stories. And so, you know, part of my direct observation of the environment, I documented this, and also the interviews, you know, I recorded them, and it informed a lot of my data.
I have a comment from Ms. Scanlon. She said fear of deportation continues to drive vaccination reluctance and resistance.
Yes.
And Ms. Jones has her hand up as well.
I'm just wondering if you if your research study was done in like in a different time frame, would your outcome be different? You know, you couldn't have done it at a worse time, especially that population, right? So, you know, just wondering.
Yeah, no, that's a good point. Time also, right? That impacts a lot. I don't know what other administration we could have done this, but maybe it wouldn't have been so fearful at that moment. Yeah, you know, it was really sad. I had seen where they were keeping some of the families that, you know, they were separated from their children, and they had just so much that was happening. And I don't know that prior to that, the situation would have been the same. Maybe it would have been a little less fearful environment. You know, this rhetoric was everywhere. It was inflamed, and I think it probably, the study could have done better if it was before this time period. Absolutely. So most common methods used in clinical trials, qualitative methods in clinical trials are those we just covered. So in-depth interviews, focus groups, cognitive interviews, and observations. So what happens with the data we collect, right? The researcher and the coding team applies codes to data set, which involves reading of transcripts, identifying, selecting, and applying codes. So all of this information gets recorded, it gets coded, and it gets organized. And coding is a process of organizing the data to see the connections and identify common themes. This is an example of how data gets organized, right? The team gets together, they create the codes, reading the transcripts, right? There's emerging themes. Well, what are we going to, you know, assign this code to? And under this code, what's the description of this code? That's what this means. And where do we see it? Oh, this is a quote that falls under this quote, this code, and this description. And that's how, you know, the data gets organized, and which is the process of coding, right? And we see the connections and it becomes rich data. So why is qualitative research important in clinical trials? Researchers want to hear the patient narrative. It improves interventions, it improves health programs and initiatives. It gives a voice to the patient. You know, patient stories are valuable, they matter, they're rich. It inspires and it illustrates from the patient perspectives, and it helps identify norms, patterns, trends, all of these things. And even it can provide nuance to a complex issue and problem, such as, you know, what I uncovered at El Paso. I don't know that could have been captured if the researcher was just using questionnaires. They're only interested in one thing. You know, it helps interpret and understand implications of phenomena or policy, and it strengthens really clinical trials by enhancing participant involvement. So it's really, really just an important part of research, or at least, you know, medical health professionals to really, and researchers to really think about just from the beginning, just as they would with quantitative research, include qualitative research, include the voice of the stakeholder, the patient, the participant. You know, let's get pilot, you know, studies before they go out into the general or larger sample size. Qualitative research is just such a rich way of really giving much more value and insight and informing what we already know, but even more, and contributing to science in a way that just is really powerful. So that is my spiel on qualitative research. And, you know, if there's any questions, yeah, I'd love to hear them.
You know, Ms. Vera, first of all, I want to acknowledge the courage it took to do what you did during a pandemic. And it underscored to me the profound commitment to the practice and protocol. You walked the talk, sister. Thank you for that.
Thank you.
I don't see anything in the chat yet, but if anybody has any questions later on, they could just email me and I can ask Jacqueline later on.
Great, thank you.
Okay.
Well, I thank you so very much, Jacqueline. Great presentation. I really enjoyed it. Eye-opening. Thank you. Thank you.
Used Madison Avenue historically from the 50s on in identifying target populations pitching product, creating campaigns to win hearts and minds that would ultimately impact the bottom line of whatever company was bringing a product to market. Did you ever study those methodologies alongside the methodologies that are perhaps more modern, that I believe also draw on that bank of knowledge that is used in political campaigns, determining what is the message, who do we want to reach, how are we going to access the particular group, what is the best modus operandi to connect? So at the end of the day, the participants, whether they're consumers or whether they're clinical trial patients, both know, like, and trust who we are and what we need from them in order to accomplish our goals. I'm wondering, I'd love to hear from you, please, if any of your knowledge base draws from either the political realm and or advertising techniques. Thank you.
Well, we thank you. We thank you. That's a great question.
Can I? Hi, I'm sorry I came late to this, but I wanted just to share some of maybe the things that I've been doing at the Bronx Community Health Network as a outreach lead for the All of Us research program. And what I've been told by people who are part of my community advisory board is that it's very helpful to have the voices of people who currently participate in clinical trials, to actually sort of speak with them almost like a case study. And I've started doing that, and I've gotten a very good reaction from that. So it's sort of like having someone who an average person can pose questions to about their experience and their journey to deciding to be part of a clinical trial, and how their perceptions may have changed after being a participant.
Well, you know, when you are participating in a clinical trials and it does change your precipitation, your perception of clinical trials and of the experience, I think that is so powerful. I think there should be a way more and more to get people who have been involved in clinical trials. How do we get them to talk? How do we get the word out? It's almost, Paulette, do you guys have a brochure, a bulletin or something where the community people let their voices be heard for other people?
Well, I've basically been using contacting people that I know in the community who have been very open about their participation. But other ways that I've done it is I simply asked through my network of people that I know if they would spread the word and find out if anyone would be willing to share their experience, and making sure that they know that I wouldn't be asking anything that would reveal, HIPAA related information about them, and that this would be an interview where I would give them the questions beforehand, and we could agree to where the conversation would go. But yeah, I've done it up till now through my own, network of people that I've contacted over the years for various projects. Yeah.
Over the years. Well, you know something, I think that's great. I have to commend you for that. Just keep doing it. And I could see it expanding, especially during this time, because there's so many people who are just afraid of clinical trials and they don't know what to do, and they are overwhelmed by the whole COVID and clinical trials, and they don't understand it. So you know something, keep doing what you're doing. And if there's a way that we can help get the word out, let us know.
Yeah.
Okay?
the way, and I'll be quiet after this, but the way we post it is we have a podcast page, and I also do the transcription, so that people can listen to it, they can read it. There are ways also of publishing the contents of the conversation in, let's say, Bronx newspapers, because you can have paid articles where you're essentially taking the conversation and changing it to the indirect, an indirect narrative, and there you have your article. So it will reach a lot of people.
Oh, I think that's absolutely great. You know something, Paulette, if you can, share your podcast page with us.
Okay.
Okay, thank you.
So I would like to respond, one up to the question in the chat, which I saw Jacqueline answered to a bit, and I'll qualify, but also to speak a little bit to what Paulette was sharing. In my introduction, I shared that I'm in 3 clinical trials. I am a person that used to never participate in clinical trials or studies. I am a COVID-19 survivor. And immediately I understood that as fearful as I was, or concerned as I was, given the history of how Blacks and Black people, poor people, that have been marginalized, have been treated, I said I needed to participate because there's no information out here. And if I'm a person of color and I don't participate, then how are they going to get information? Right. So one of the things that happens with, I feel, with vaccine hesitancy and reluctance is we don't have enough people participating. And one of the questions that get asked, well, how many Black people, how many Latin people participated in the studies? But if we're not participating, then they can't get the numbers. And so understanding that my decision to do that would influence the numbers that the researchers would have, but also I could satisfy any questions that I had, build a relationship, and then talk to my community. So the importance of getting people in clinical trials, we could give people a lot of information, but they want to hear the lived experience, qualitative, what we're just talking about, of people who've done it. So I can say, yes, I did a clinical study for the vaccine. I did a clinical study for how COVID affects your lungs, how it shows up in your bodies over time. And then encourage people, well, this is what happened. This is the size of the needle. This is how many needles. This is what they said. This is what they asked, because that unknown of what happens behind the room, or what people are going to do with that information. And then being able to put it in plain English, right? Or plain Spanish, like whatever language that people are speaking in, so that they can be comfortable with their hesitation or their fears or their concerns. And I just think we don't do enough of that. Getting people who look like them to tell about the study. Right. So those are things that I think make a difference. And I've been in spaces where by my sharing my experience or what happened to me as a result of getting COVID can motivate people to do something they wouldn't have done before. And that's the power of the shared story. And so
thank you for that, Diane.
Right. So you're welcome. And thank you for letting me share that. Because I'm really passionate about it. I talk about vaccines. I talk about, the length of time, just whatever. I'm open with that so people can be comfortable to make a decision. Not telling people what to do, but have them get more information so they can make a decision.
Mm-hmm.
And then my question was about, what was your knowledge or understanding of how qualitative research was used to develop the vaccines? Because I think that when I listen to the challenges that we're having for vaccine hesitancy, one, I think that had they spoken to focus groups, they could have shared what their concern was, and that could have been addressed with the study. So like, for example, the speed at which was done. Once you get a handle of the language and knowledge about the speed, it makes it a little easier to know that the speed is not a hokey doke set up by the former president. Okay, that existed already. You could do that and then incorporate that. So I was curious about that. is there information about a qualitative study, or do we know if those developers took that route?
Yeah, I don't know per se in terms of qualitative research. You know, the interesting thing about the pandemic and COVID-19, this was fast. And qualitative research takes time, and it's expensive, right? Like when we think about funding, this is over a time period. We're collecting stories, and it's not so quickly, you know, it's not feasible, right? Like it's not and that's the unfortunate thing about, you know, the timing and when it was necessary, and also sadly how qualitative research just really hasn't been commonly used in all areas of the medical field. So if we had more knowledge prior to the pandemic, even on vaccine and more data, that could have informed maybe perhaps a better way to approach this scenario, this pandemic, which was worldwide. So now public health, we have a magnifying glass on us. You know, we do want to take advantage of qualitative research and how that can help us be more prepared in the future and engage communities of color. I struggle with that with my own family. My mother is like, no, I'm not taking that vaccine, and I got it. But it's about, you know, the broader community, her social circle, who she engages with, where she's getting her information from. And, you know, public health, we really haven't been at the forefront because we haven't been funded. You know, this also involves money and funding. And if we're lacking from, you know, from previous administration that we just ended, we didn't have the funding there. We were not focusing on these types of research. And so hopefully that will change. I have seen at Sloan, you know, we're conducting a lot of qualitative research with understanding for healthcare practitioners, you know, their experience at the height of the pandemic. And I'm hoping that more and more, you know, institutions, or at least other organizations, will jump on board and start doing this with communities of color, understanding like what you said, you know, we need more education around vaccine. We're still not there yet. We have a lot of work to do.
Maria has her hand raised, and then we will start Ms. Crowder's presentation. We're running a little behind now.
Okay, I just want to say thank you because all the presentation was really helpful for me. I'm Hispanic native, so I think that listen to you and start listen. A lot of people encourage us since little, like I think that I am, to be more like, doesn't think just in a number of patients, just think that you can help them, you can get the confidence of them. So I just gonna say thank you for speak for people that doesn't have a voice or doesn't have the opportunity to talk, because I think that is amazing. Just that, thank you.
Thank you so much. I thank all of you for your great comments, lively conversations. I have to tell you, I'm thinking of podcast. So I will be sending out emails for podcasts. Now, I'd like to welcome, thank you so much, Jacqueline. That was a great presentation. I really enjoyed it. Now we will have Miss Tamara Crowder, and she has a Master's of Science and a Bachelor's of Science. She works at the Weill Cornell Clinical Translational Science Center Core Laboratory Supervisor since 2018. At Cornell, she assists clinicians and junior investigators in implementing their research projects while she and her staff continues to maintain the multifaceted CTSC lab as a NYSCLIA certified lab. Prior to that, she served for 7 years as a lab supervisor at Columbia University Clinical Flow Cytometry Laboratory, providing immunophenotyping diagnostics to NYP Columbia. She was the recipient of the Dr. Nathan Lane Award for Clinical and Educational Excellence in 2011, a New York State Certified Clinical Laboratory Technician since 2009. Ms. Tamara has over 20 years of laboratory experience in research and clinical laboratories. At Einstein College of Medicine, she completed an MS in biochemistry with a research focus on enzyme mechanics. She also holds a BS biology from Harvard College. The next voice you hear will be Ms. Tamara Crowder. Welcome.
Thank you for that amazing introduction. Can I share my slides, Agnes? Is it time for that?
Yes, yes, you can go ahead and share.
One. Okay, so you can see it, right, Agnes? Can everybody see it?
Yes.
Okay, great. Okay, so yes, I'm Tamara Crowder. Thank you for that wonderful introduction. And thank you, Jacqueline, for your presentation. It was very lively and informative, and I'm glad to see so many people interested in clinical research because it's crucially important to everyone's health everywhere. So we need to get more people involved and get the word out to every community that your assistance can make healthcare outcomes better for the whole world. So I am Tamara Crowder. I'm the CTSC Core Lab Supervisor, and I will be talking about qualitative research. So the best way I think to start talking about qualitative research is just to remind people the differences between quantitative and qualitative research, but good research needs both. Research goals are accomplished by using qualitative and quantitative research techniques. Qualitative data is expressed in words. It's more about concepts, thoughts, ideas, experience. And this type of research enables you to gather in-depth insights on topics that are not well understood. Common qualitative methods include interviews with open-ended questions, observations described in words, and literature reviews that explore concepts and ideas. Quantitative data, which I'm going to try to discuss in this lecture, is best expressed in numbers and graphs. It's used to test or confirm theories and assumptions. This type of research can be used to establish generalizable facts about a topic. Common quantitative methods include experiments, observations recorded as numbers, and surveys with closed-ended questions. So we're looking for more numerical data in quantitative research. And in this talk, I'm going to follow a COVID-19 example scenario to hopefully give some real-world insight into why this research is important. So in quantitative research, scientific questions are addressed with numerical analysis using computation techniques. The researcher is interested in the relationship of the numerical data and related events. So the scenario I'm going to follow in this talk is New York City COVID-19 positivity rate among different age groups and how it changes. So I'm going to follow two age groups, 17 to 25 and also 75 plus. And at the end, I'll show an example of a few days and how the positivity rates are different. And my working hypothesis is that older adults have an increased COVID-19 positivity rate because they're more susceptible to the disease. So there are 5 characteristics of quantitative research. The first one is objectivity. So how do we define objectivity? Objective research is not influenced by personal feelings or opinions. So in this scenario, we're going to use a COVID positivity test. It's either positive or negative. Whether or not you feel like you were exposed to COVID in the past, the laboratory test can give you a concrete answer. So even though you may have felt symptomatic at one time, you don't know what virus is causing your illness. So an objective research does not so much ask you about your feelings, but whether you're positive or negative on a laboratory test. So the second characteristic is that there's clearly defined questions. Clear questions are not ambiguous or open to more than one interpretation. So again, in this example, we're asking what the subject's age is. And again, that's a numerical answer. And is there COVID-19 present in the respiratory system? A yes or no answer, although sometimes the results can be inconclusive. So nothing is ever 100%, but we're asking what the laboratory test results show. We use standardized tools to get quantitative data. So how do we standardize these tools? Standardized tools have undergone rigorous testing and have been approved for use by the US Food and Drug Administration. Lab tests are standardized by the manufacturer through a validation process. The validation process proves the accuracy of the lab test. So in this scenario, labs use the COVID-19 rapid PCR test to determine COVID-19 positivity. And how do we determine that this test is giving accurate, reliable results? That's through the validation process, which I'm going to describe a little more next. So to determine accuracy, the validation process defines the specificity and sensitivity of the test. Specificity is designed as the extent to which a diagnostic test is specific for a particular condition. Again, in this scenario, the COVID-19 test must only show positivity for COVID-19, not other respiratory infections, for example, the swine flu. So if you're feeling ill, you don't necessarily know what virus or bacteria is affecting you, because symptoms are the same for many different kinds of infections. And symptoms may be different from patient to patient. One patient may be asymptomatic and may just feel tired or under the weather for a day or two. Other COVID-19 patients need hospitalization, need oxygen treatment. So although they're both experiencing the same viral infection, they have very different outcomes. And so the other importance of the validation process is that it determines the sensitivity of an assay. So what is the test ability to correctly detect ill patients? And then in this example, we want to know the minimum amount of COVID-19 particles able to be detected by the test. Because there are some people, as we know from what happened in the White House a few months ago, who can be COVID-19 positive. Even though you're tested every day, you can be positive and not be expressing it. So the rapid PCR test is the most accurate test that we have at this point, but there are still sometimes cases that will go undetected. So we need, in order for a test to be approved by the FDA, we need to determine what the sensitivity and specificity of the test is. And that is done through the validation process. So the fourth characteristic of quantitative research data is that it provides hard data. So what is hard data? Hard data is quantitative data in the form of numbers or graphs. Again, it's the COVID-19 lab results are an example of hard data. You get a positive or negative result. And then sometimes these concepts are best understanding by contrasting with qualitative data. So in contrast, qualitative data, soft data, can be defined by opinions, thoughts, and ideas. The last characteristic is that quantitative research is repeatable. So the results obtained by an experiment or observational study should be achieved again with a high degree of agreement when the study is replicated with the same methodology by different researchers. If the experiment were repeated under the same conditions, the same conclusion would be achieved. To ensure reproducibility, there are quality standards with known values tested alongside the subject samples. Testing labs across the country run the same standards, often commercially available. If the values fall within the acceptable range, the test is considered to be working properly. So in order to provide diagnostic results to patients and doctors and medical facilities, the lab must have reproducible results. So if you got your COVID-19 test in New York or you got your COVID-19 test in Texas, and you were tested on the same day, you should have the same results. So that's why standard samples are run all over the nation to determine if the laboratories are providing accurate, standard, repeatable results. So how is reproducibility measured? It's measured through accuracy and precision. And this is a chart that's often used to describe accuracy and precision. So the perfect ideal data is both accurate and precise. So the data is in the middle of your target, highly accurate and highly precise. Low accuracy and precision is data which is scattered throughout, missing the target. Low accuracy and high precision data is congregated around one point, which is not the point of that you're looking for in your data. And high accuracy, low precision data is near the point that you're looking for, but scattered throughout, not in a nice tight clump, it's scattered. So precision is defined as how close results are to each other, and accuracy refers to how close measurements are to the actual true value. Again, ideal data is both accurate and precise. So those are the 5 characteristics of quantitative research. It's objective, clearly defined questions, standardized tools, hard data, and repeatable results. So what happened in this example that we're giving? So these are the results for this particular scenario. And I'm looking at data that's available from the NewYorkCity.gov website. And if anyone is curious about COVID, there is so much data available through the New York Times and the New York City websites. It's just a plethora of data. So you can almost track any sort of question that you have about percent positivity rates and outcome hospitalization rates. You can even look, I was on the New York Times website the other day, you can even look at individual hospitals throughout the nation and find out how many positive patients they have in the hospital, how many ICU beds are available. Anyhow, I just find this scenario to be really fascinating as a researcher because there's just so much data available. So for the 4 data points I picked, the 75 plus population had a higher COVID positivity rate than the 18 to 24 year population. So again, this is something that you, if you're curious, you can look on the New York City website and get more information. But for my limited experiment, I am suggesting that my hypothesis is correct. And for the dates indicated on this chart, older adults do have a higher COVID positivity rate than younger adults. Okay, that's all. Does anyone have any questions? I know I went through pretty fast.
Ms. Jones has her hand raised.
Yeah, just in terms when you were talking about data and the availability of data, there was an issue early on where it wasn't broken down in terms of race, gender, geography, and things of that nature. So while there's a lot of data now, it came because people were concerned and adamant about breaking it down, like to the finer points of how many. You mentioned like age groups, but of that age group, in terms of the race, in terms of gender, so just and geography as well.
So I have seen good breakdowns in terms of zip code and geography for COVID positivity. Unfortunately for race, I haven't seen anything that specific. I think part of the issue is race is something that's sort of self-determined, so and not everybody is comfortable assigning a particular, it's just not something that's in cut and dry as, for example, your age or something defined through a birth certificate. So I think racial categories get kind of complicated and difficult. Does that answer your question? But I have seen quite a bit as far as geography is concerned.
I have a question.
Sure.
Hi, yes. Okay, so my question is, good afternoon, everyone. I'm sorry, I came on a little bit late in the other one. My question is, there are a significant amount of people who have passed away due to COVID-related circumstances. That is the data that I would really like to see. I think the world needs to see that data, because how do we know the numbers truly? If people had COVID-related, I mean, what does that mean? Does it mean that they were in the waiting room, or there were no hospital beds and they died of something else, but since it's related to COVID, then the situation was COVID related? I mean, do you have any information on those numbers? Are any of those numbers factored into the data information that was presented today?
Yes, it wasn't presented today. There is information about COVID deaths, but like you're suggesting, I mean, it's really hard to get you can't get anything 100% correct. I mean, there's no way to know for 100% how many people died of COVID, because people started dying before they were tabulating COVID deaths. There was definitely COVID present in the population in New York City, in the United States, before it started becoming defined as a pandemic. So you're never going to get 100% numbers, but there definitely is some data out. Like now they're saying with what's going on with Governor Cuomo, I don't know if you guys are following that, but he's getting in a lot of trouble because perhaps, I mean, when we look at this situation 5-10 years from now, we're definitely going to find that there were a lot of things that could have been done better. But in the same sense, we're all in a situation that none of us have experienced before. So nobody is going to be perfect in their response. And I think, 99% of people are doing the best they can. But
okay, well,
again,
so
does that answer your question?
Okay, so I wasn't expecting to know the information 100%, but it seems as though that like all of the information is not there. And I think the reason is because people are not necessarily focused on those who have passed away for non-COVID related, situations, because I don't know, but that's why it's so interesting to me. I would like to know, and I'm not looking for any type of perfect answer, but it would be interesting to know who the people are, how many of them, what the illnesses are that they had at the time, what were the circumstances at the hospital? Did they have a hospital bed for them? What area of the hospital were they in relationship to COVID patients? Now, I'm not necessarily talking about before everybody knew about COVID, because how could we know that? I'm speaking of the time that we knew, the time that these data, the information was, information was coming together for all of these data reports and such. Like, is anyone working on that now? Because, COVID is not over. And so, So in order, excuse me, in order to be able to help remedy a certain situation from occurring again or repeatedly happening, then we need to know the answers to that. You know, it's almost as if, okay, we have money to build hospitals. If we don't, we need to create some to build some more hospitals. And then you could possibly have those patients over here, COVID, and these patients over here who are going in for non-COVID related situations so they could stay alive. Because you know, I don't know if you know of anyone, but I do know people who are actually waiting in waiting rooms and they've passed away from other illnesses, which is really not COVID related. But if you want to say they were waiting because doctors were working on the COVID patients, then it could be COVID related. So, you know, it's such a gray area. And I think I think that's what we need to know, so it doesn't continue to repeat. Okay. And I know that this is the report on, you know, positive, who's positive, and, you know, negative and such like that. And then there's something else at the nursing homes, right? At the nursing homes. During that time, you had all, I mean, you know, God bless them, the nurses who go in to see the patients. But at that time, they didn't even realize how contagious it was. So these elderly people may have been exposed over and over and over again to COVID. They are just at that location, and then you have people who are in and out. Where's that data? There's no data on that. So I'm just saying that listen, I can think of data reports all day. So if you need someone, I will volunteer, because there's so many different sides to this thing. There's so many things that can be put in and not be put in, and, you know, wanting to have an end result, and there's so much to it. So, you know, I wish more data. Thank you.
Thank you, Jazzy, for bringing.
I just have one question in the chat was sent before. Ms. Scanlon said, will New York City commit to capturing more quantitative data regarding new mutations?
Well,
yeah, I mean, I don't work for New York City Public Health, so I can't say anything from them, but I definitely think it's something that would be very helpful, especially with all the questions about different variants, which are bound to arise. I mean, the flu has different variants every year. You have different types of flu. So this is going to happen with COVID for sure. And I think there is a movement within the scientific community to encourage governments to test for different variants, but unfortunately, it doesn't seem to be happening in the United States too much right now. But I definitely think your ideas, just to go back to what Jazzy was saying about the collection of data, it's super important. And I think a lot of these things will kind of play out as time goes on, because right now everyone's focused on, you know, getting through the current situation. But when we have time to reflect in a couple of years after this happens, I think we will have time to compile all those different scenarios and try to figure out what worked best. And hopefully, when unfortunately we likely will experience more pandemics like this in the future, and we'll have a better handle on how to handle things. At least that's my hope.
Okay, Diane had her hand raised.
Right. So I was sort of responding to Jazzy and a comment that Tamara had stated earlier. In terms of race, the collection of information about race. And yes, it's self-described, but we also know that it's observable, and we can ask people how they identify. And it's essential, I think, to capture it, because then you cannot, if you don't capture race or ethnicity or other demographics to determine how folks are being treated differently or provided services differently, then you can't serve those who are already experiencing disparities. And we know that there's significant disparities. And so my challenge would be to the research community to overcome those obstacles or barriers around race and make sure to collect it, because otherwise they're functioning normative as if everybody is operating at the same level. And we know that that isn't the case. But also, so to what Jazzy was saying, I think that some of the horses out the gate on some of the data that we might want to know some information on, just because we didn't capture it at the time or we didn't know enough information. And I think knowing that I'm part of that community that's always affected, so far, been affected by disparities or social determinants of health, is not encouraging or helpful for, like, when I hear folks, researchers or scientists or educators say, oh, we need more time, because in that time, Black and brown folks or folks who are marginalized continue to die, right? Like, we don't have the same amount of time. And so I think the challenge for us, and I think about it as we go through this program, is as community members, how do we influence the research? And how do we influence that timeline? And so the qualitative story, like not waiting until 3 years from now, say, okay, ooh, we catch our breath now, let's look at it. How can we take the skills or information that we're learning now and begin to do it now so that we're prepared? We're helping to prepare for when the researchers come. And that we look at health disparities, because part of the, at least in my experience, part of the reason some of this data is not collected is how people of color get treated in the by the medical community anyway. So folks showed up for testing, but there were no tests. And when people were able to get tested, those who had higher incomes or better quality medical services got the test, even if they didn't have the same level. And that's the same situation we're facing with the vaccines, right? The idea is, even though there's vaccine hesitancy, oh, we'll just open up some sites in the communities that are most affected, but then we don't have vaccines to give it to them. So then just keep talking about vaccine hesitancy, talking about how reluctant they are, when really it's a fracture, it's a break in how the powers that be are thinking about who's deserving and how to manage inequity. So I said a lot, but the challenge is, how do we think about more efficiency, time efficiency? How do we make sure we capture race or ethnicity, even though it's movable? And how do we play a role in that now as community involved, interested, or engaged researchers? So any thoughts or suggestions?
Well, this is Lula Mae Phillips. I have a thought and plenty of suggestions. One, I think right now, we, meaning the Black and brown community, we have to really spend the time needed and to invest our time in just continuing to impact, get involved in research, continue to be involved at the Clinical Translational Science Center on various levels. So we have our community advisory board. We also have various cores in the CTSC, and on those cores, community people are welcome to become a part of the various cores. And we talked about the cores in the first session that we had. So you are welcome to come and listen and make your opinion heard, make your voice heard. And it sounds easy, and it is easy, but it requires ongoing commitment. Because yes, COVID is going to be around for a little while. And as Tamara, I think, implied, there's going to be additional issues down the road. There's more coming. But in order to face issues of the social determinants of health, and to face health equity, the B&B community has to spend the time, has to get involved. And the Community Research Academy is a great way to start. It's a great way, just continue, and encourage other people to get involved. because involvement is the key. Or else, as you just said, Diane, when we talk about reluctancy and hesitancy for the vaccine, it will still be something that is going to be said. But if people in the actual communities are involved on the first line, actually able to get in contact with the people who are sending out the vaccine, actually able to get to the governor or get to whoever is handling that whole process. It's very important. So it requires time and commitment. So I thank all of you guys. Agnes, are there any more questions?
Yes, Ms. Jones has her hand up.
I'm sorry, I just wanted to just make it known and that I'm the one who asked the question about the race and gender and all that, but specifically about race. And I was distracted when you provided your answer, and I was not satisfied with the answer. So I appreciate Diane and other people, because I was actually distracted. I have another meeting that I'm going to go to, but I just want to make sure to state for the record that, yeah, I'm not satisfied with saying like there's some ambiguous race. There's no, or people are not, putting down on coding themselves. So I echo what Diane just said. I just want to make sure that was stated for the record that I wasn't really satisfied with the answer, the response. With all due respect to everybody, thank you both presenters. I appreciate both presenters. Thank you. And Diane, I wanted to say thank you for sharing.
Well, I just want to say one thing, and that is the data can be obtained about a lot of, in terms of race. Yesterday, I think Agnes and I was looking at data. So what we will do after this, after we finish the class today, Agnes will send out some information on the data, okay, in terms of the number of Black and brown people that were in the various trials around the country, okay? So it was from coast to coast. So we will send you that. There's a lot of information. There's a lot of data that's being collected ongoing. So there's a lot of things that they won't have. The city will not be able to tell us right away. It will take time. There's a lot of things they do collect information and data on. When I worked in hospitals, you could go to various sites and find out how many people died in the hospital and what was the cause of death. And I don't remember now if they, it might be there. I don't remember now if they talked about people who died in the emergency room versus in the hospital. I don't remember that, but it might be there. So I hope that helps, but we will send you that.
Okay, I think that covers the questions. I will go back and see what questions were missed throughout the session, and I'll email the presenters for the unanswered questions. We had a couple, so I'll go back in the chat and see. Just email everyone.
Okay, before we leave the Community Research Academy today, I just want to remind everyone, start taking your pictures, take your pictures, and send Agnes your pictures and your bio for the photo novella. And when you're taking the pictures, write down or summarize why those pictures are significant to you, why you took those particular pictures, and what do you think, what kind of research or what kind of impact or change you would like to see regarding those pictures. For example, if you're taking pictures of fast food in your community, maybe you'd like to see more fresh fruits and vegetables. If it's you're taking the fresh fruits and vegetable stands in your community, maybe you'd like to see a greater variety of fresh fruits and vegetables rather than just oranges, apples, and bananas, and maybe onions and maybe potatoes. It just depends on your community. So I just want to remind you, take your pictures, and we're looking for your comments. What we want to do with those pictures is we want to put them on Instagram, and we want to do a virtual art gallery between us and Hunter College. So it'll be a virtual art and going on and on and on. So that's what we're working on. So I thank you all so very much. Have a great week. And I enjoyed listening to everyone. Thank you.
Thank you.
Thanks, everyone.
And thank you for our great presenters.
Senate, but also White elections.